Hi, I'm David Liebeskind, speaking to you from the USC Neurovascular Institute, talking to you about collateral circulation. So collateral circulation we know has been important for hundreds of years in terms of blood flow in the brain, and specifically with respect to ischemia or ischemic stroke, both in terms of different stages, in terms of the onset of stroke, the likelihood that you're going to develop a stroke, as well as in terms of what happens once someone does have a stroke. Collaterals are important. These are alternative blood flow channels that provide blood flow when the main artery is blocked to the brain, and it offsets the ischemic injury or the damage that is done. It is a compensatory mechanism where the brain actually is able to sustain itself against the lack of blood flow in that region of the brain. Collateral circulation is seen with a variety of different imaging methods, and this is where we've learned the most about collateral circulation, originally from angiography, and in most recent decades from non-invasive imaging as well. So we see correlates of collateral circulation in terms of every type of imaging that we do. Indirect correlations, so not necessarily the direct collaterals themselves, but the collateral blood flow or perfusion, the collateral arterial routes or the connections or anastomoses that we call them, as well as the consequences in terms of what happens in terms of the amount of ischemic damage, as well as what can happen in terms of reperfusion injury and hemorrhage. So collaterals are important because they reflect the likelihood we're able to reperfuse the brain, to what extent, and the recovery after stroke as well. So grading collaterals is very important. We do this routinely as an imaging core lab, but it's done in routine practice on a daily basis from non-invasive as well as angiographic methods. Collateral circulation has been associated with different demographics, different patient status, comorbidities as well, and it is important to think about these things in terms of diagnosing patients, not just with stroke, but in terms of their collateral status and the likelihood that they're going to rapidly progress or not. This is important because we can plan treatment based on that. We can plan how aggressive we need to be or should be in treating that acute ischemic stroke with endovascular therapy or other alternative approaches. Increasingly, and in recent years, this is important in terms of neuroprotection or cytoprotection, where we try alternative methods of protecting the brain. Patients with poor collaterals may have a greater need for neuroprotection or cytoprotection, where the brain is not able to recover as well. So grading collaterals in terms of these indirect measures on imaging is important, whether with CT or MRI techniques. In sum, collaterals are very important in terms of how patients do from A to Z throughout the entire course of the disease, and it's very important to use the imaging that we have available on a daily basis to estimate what we can do from a therapeutic standpoint. Thank you.